Good evening, everyone. It's 5 o'clock. Call the meeting to order. Carrie, can you please call the roll?
Councilor Clark?
Here.
Councilor Beach?
Here.
And Councilor Herbstreit?
Here. We have before us the minutes from the January 19th meeting, which was the last time we met. If there aren't any edits, changes, or deletions, I'll entertain a motion to approve.
So moved. Second.
We don't need a roll call on that. All those in favor? Aye.
Aye. Aye.
Now there's time on the agenda for public comment. Is anyone here who would like to speak other than all of our department heads? All right, thank you. Let's see, we're gonna swap the agenda, is my understanding. We're gonna start with the fiscal year 2023 proposed public safety department budgets, and that's presentation will be Celeste Broadstreet, Financial Services Director, and Dan Hoffman, City Manager.
Thank you, committee. So today we're going to dive into the various public health and safety department budgets. This will be your chance to dive in a little deeper than we would at the full council level on some of these items. Also in the backup or after the slides is the line-by-line proposed budget. What we'll go through today is the highlights of each of the different departments. You know, we have representatives here from the various departments, so I may, if there are some detailed questions about a particular request, I may call on one of the representatives here. If I do call on one of you guys, just make sure you step up to the microphone too so we can record it. So today we're going to cover sheriff, courthouse security, Commonwealth Attorney, police, ECC, fire department, emergency management, social services, and the juvenile detention center. Start off with the sheriff. What is this on the screen?
It is.
Perfect, thank you. So this is one where we are actually proposing to add 2 new positions. This is really to address the issue with the temporary detention orders we've spoken with council about in the past. It creates a significant amount of drain on both the sheriff's department and the police department, and these 2 positions are specifically to address that issue. We had a very productive meeting today with the police department and the sheriff's department to talk about resources and how they'd be allocated. So we have confidence that this will at least ease some of the pressure on those 2 departments. It's not going to solve the problem. Obviously, there's still larger state issues at play, and definitely no solution, no complete solution is going to be possible without state and the cooperation of other jurisdictions as well. So, although we still keep waiting to hear what the state might do to try to help us out with this, we hope these 2 positions address it. Then we have a small increase for the training academy, the cost of the training academy, and 2 replacement vehicles. The sheriff's office does have a significantly aging fleet, and this is meant to address that. I'll pause here if there are any questions about this one.
Okay. Thank you. 2 things. How long will it take to fill the 2 spots? How soon?
Sheriff Taylor, what's your average time to hire right now about?
To fill the 2 spots, it won't take very long at all.
Do you need any, I don't see anything in here for is this training academy for those 2 positions?
No, that's for the academy increase their dues
Okay.
for this coming fiscal year, so that's what that increase is for.
So you're okay with all right. Awesome.
And we'll most likely hire certified individuals. So.
Great. Thank you. Dan, I see on this first segment we got sheriff, police, whatever, and they have vehicles. Do we have any standardized procedure when vehicles should be replaced? X number of miles, X number of years?
We look at mileage, and of course there are other factors. Sometimes we get a lemon, but barring some type of unforeseen mechanical issue, we look at mileage.
Good, that'll help us budget. Thank you.
Any questions?
Moving right along. Commonwealth Attorney's Office. So $20,000 for the Attorney Premier software. I'm not going to try to explain what that does, but we do have the Commonwealth Attorney here. And also, you know, it probably comes as no surprise, that office is very training intensive, keeping up all of their various certifications and licenses. So we needed to restore some training in order for them to stay current. They were very diligent and also trimmed some of their operating expenses to help ease the increase. I'll stop if there are any questions for Commonwealth Attorney.
I would be interested in what the Attorney Premier software is.
Thank you, Counselor. Attorney Premier software is addressing the body-worn camera issue. So the software company provided it to us without cost at first. As we were able to start to incorporate body-worn cameras into our discovery, they then developed a software that would help us to do so without missing any, having things fall through the cracks. And therefore, to meet our ethical obligations, we need to have the software. They created the problem and they created the solution, essentially. But this will allow us to make sure that the defense is provided with all of the body-worn cameras, as well as all other discovery electronically. That way we do not have to have them come to our office for open discovery, and also we can make sure that everyone is getting everything. And a lot of times we'll have defense attorneys change, and this can have an electronic path to show the discovery's been provided to the various attorneys. So this is the way that we can make sure that everyone's getting their due process rights fulfilled.
Good, thank
Yep,
you.
thank you.
Makes sense.
Heather.
Hang on.
One more question.
All our law enforcement, whatever, don't have body cameras yet, right? Everyone, sheriff?
I believe everybody does.
Okay, so we're not at capacity on that software.
Well, we did negotiate. We worked very hard with City Hall to negotiate for our purposes to have unlimited access. So because we were at the front end of getting in on the new software, they made it so that everyone in my office will have access to the software from our standpoint, and that's different from the negotiations for the police departments and their capacity. So that's it's different software for from the same provider.
The 20,000 is listed as an operating, that's a licensing cost every year?
Yes, sir.
Not one time, okay.
Yes, and that was negotiated. Again, it's below it's going to be the standard market price.
Great, thank you.
Yep, thank you.
Heather, real quick, one of the big nightmares with this photographic evidence is the storage issue. Are we on top of that? And I guess the follow-up question is, do they hold the storage or do we hold the storage?
So from the prosecutor's side of it is unlimited storage.
Okay.
And that includes anything we upload to it as well. So if a citizen provides video from their phone, for example, we can upload it through our software and we're not charged per storage. It's different with respect to the police department.
Thank you.
Thank you.
And one more thing to point out, the city's been working closely with the Commonwealth Attorney's Office to upgrade all of their systems over there up until about now, because they're currently implementing it. They operated an entirely different network and system. Their broadband access, well, could you call it broadband access?
It was an antenna.
Yeah, they had an antenna over there, so we've been working very closely with them for the last.
And I cannot express my appreciation enough for that. It's imperative that we have, we now will have reliable internet that we did not have before, and reliable email, which we did not have before. So,
Wow,
yeah. So thank you for that.
thank you.
Are there any other questions for me?
Okay, police and the ECC. So I know this shows a decrease, but we are making a lot of investments in the police department. There is a decrease for vehicle maintenance and insurance. I think a lot of that stems from the fact that we've been replacing a lot of the aging vehicles. There was a decrease in training because we're using some one-time funding, and then they really sharpened their pencils and found some various areas where they could cut. We are using operating capital for 4 additional replacement vehicles, decrease of 26,000. So, but the overall increase with salaries and some pay adjustments is an overall increase of 7.3%.
With all those decreases, I don't have any questions.
Good job, Chief.
Thank you, Chief.
Moving on to the fire department. So we are trying again for SAFER. Didn't work out last time. We put in for 7 firefighter positions, so if approved, it's about $440,000. We do have some money set aside for gear and equipment. It may not be enough, so if we do get these, we may be coming back for some gear and equipment. But we do have a fair amount in the ARPA set aside for firefighters. These will be on top of the ones we added in last year's budget, and I believe we also added 3 mid-year using ARPA funding. They also were very good and sharpened their pencils to find some savings otherwise. Chief's been working diligently to create new MOUs with all the volunteer companies to realign EMS funding, and there's also a decrease here for our one-time funds. So even with a lot of these investments, and they may only reflect about a 2% increase from 1.9. Once you factor in our ARPA investments in the fire department, it's far greater than that. So happy to take any questions.
If we get the SAFER grant, we're in 3 years. After 3 years, we pick it up.
Yes. It's still. It used to be that it would. You'd have to pay gradually more each through 3 years. They've changed it so they cover the full amount for 3 years. So after 3 years, the city will be on the hook for the entire amount.
And what's our option 2 if we don't get approved for that, to get some more firefighters on staff?
We'll have to do what we did last year, reevaluate, see what we can do with stimulus money or some other sources. But for now, I'm going to sound like a broken record. I was optimistic before. I'm going to be optimistic again. We had some really good conversations with the federal agency in charge of distributing or awarding that grant. So we feel like we understand them a little bit better. They understand us a little bit better. So we're walking into this, I think, a little more confident than last year.
Good, thanks.
Councilor Clark, questions?
Emergency management. Scott's here. Maintenance contracts and the radio are going up. We do have a significant amount of money set aside in our ARPA allocation to begin replacing radios. But overall, this budget, aside from the maintenance contracts and some personnel increases, it's an increase of 4%. It's a relatively small budget, though.
You said replacing radios. Is that a cyclical thing where individual units wear out, or they have a service life?
The current models are going to end there. They won't be supported anymore, so it'll become more and more expensive to replace them over time, or we may not be able to replace them over time.
Gotcha.
They won't just stop working, so we'd have a little bit of time, but it's one of those things we probably should take advantage of the stimulus money right now to start that process.
And it goes without saying that all these radios are interoperable?
Oh yes, absolutely.
All right, thank you.
All right. Dan, I've been working with some groups trying to get the utilization of drones more in the city and whatever, and also get it at our schools where they can get a certification to work on them. Do we have anything like that at the Innovation Center, or is there any that you know of where they can actually work on these radios?
Not these radios. The radios have to be maintained through a contract through Motorola. We don't want to violate the contract. And Scott still is our king of drones. So if you want to give a quick update where we're at with the drone program, we did make some investments with our stimulus money last year that Scott's been implementing. So Scott, why don't you give a quick drone update?
We've enhanced adding, we have up to 10 drones right now and 10 pilots, various capabilities of those drones, but we're working with the group that you're referring to as far as implementing smart city type initiatives, including the educational piece at the Innovation Center. But as far as the radios go, no, that's it's more of a certification type. You have to be careful with how you maintain those. So, but the drone program's growing.
Yeah. And kudos to Scott. He mentioned we have 10 licensed pilots, all city staff. mostly?
Most of the city folks that have a need for it
Yeah.
are FAA certified pilots.
Yeah, so for a jurisdiction our size, like 10
It's
FAA
phenomenal.
certified pilots is just fantastic. Everybody from aiming the communications team to PD, they're used regularly. So I think we've definitely moved, as I look across the country how drones are being used, we've definitely moved from a novelty phase with these things to they're now deployed on regular operations. So it's been great to have Scott lead that charge. Cool. Social services. We are adding one new position, human resource assistant. That is not human resources. Human resource assistant, so that's a social service position. Our share is only a little over 17,000. Just like last year, anytime I can turn 17,000 into 47, I'm going to take advantage of that. So we're adding a position there. There are some other increases from state and federal revenue. Amber's here if you have any questions about this particular budget.
I just want to appreciate all you're doing. I know the last couple of years have been tough, not just for your department, but everybody's department here. It's been tough. I appreciate all you're doing.
Councilor Clark?
Amber, how are we doing with caseloads compared to state guidelines?
There really aren't state guidelines for caseloads.
Okay.
The only program that has a guideline that came out 2 years ago related to a JLARC study is foster care. 10 cases, no more than 15 children. That's about the only area of DSS that we have a caseload standard.
So are we keeping up with that with our number of employees at this point?
We are.
Okay. How does the caseload feel for the frontline CPS workers?
With the positions that we added in the last budget, much better. We've got caseloads to where we need them to be, and I think staff are feeling better about their caseloads and their work as a result.
Thank you.
Yeah, you're welcome.
The next thing we have to tackle over there is getting them a little elbow room. They're really packed into that building.
Yeah.
So we are working actively. Obviously, we've acquired the building, and we're working actively to try to identify spaces for them to move into. You'll probably hear more about that in the future, but we do have funds available for some of those renovations. And I gotta praise Amber too for her work. Like was said, this is probably the hardest job in city government, because not only did it not let up during COVID, in many ways it got worse, and burnout is a real thing over there. Not that it's not a factor everywhere, but Amber has done a tremendous job keeping the ship moving in the right direction. Because when I look across the city at where I'm most concerned about burnout, it's that's one of the top departments for it. So thank you, Amber.
Thank you.
This is a question that applies certainly to social services, but across, all of the different departments. And I don't know, at some point, hearing about how competitive our salaries are compared to around us, and making sure that we're doing all we can to keep our employees.
Absolutely.
So I want to make sure that, I know that's part of the budget process, and talking about, is it this % increase or this %, and it all, of course, comes down to the bottom line on what the full budget's going to be. But I think it's, I know turnover, it costs a lot. It's I think easier to keep people and pay them a little more than lose them. But and I do know that social services is a high burnout. So
It is, and we recently just started doing hiring bonuses as well. I believe we started that
Just this week.
just this week to try to encourage folks in some of these hard to fill positions. DSS, is chief among them. We've been doing it for police as well, various parts of the city where it's just difficult. We're in that odd stage of the budget right now where all of the other jurisdictions are also kind of staring at each other, trying to figure out who's going to get what percentage increase. So it will be interesting to see, especially after this, how this all shakes out, where people land. I've heard some jurisdictions talking about 10%. Obviously you saw the article in the paper about schools getting 7 or proposing 7 at least. We're being as aggressive as I feel we can, but it still might not be enough. So, Juvenile Detention Center. So operating decrease, we had one-time expense to replace the intercom system. We're making some HVAC system repairs. They also have been very good at sharpening their pencils and finding some savings wherever they could. It's still an overall increase of 1.6%. And Aaron's right there. So if you have any questions, we have some more. Lonnie.
Good.
And now, that's it. Discussion? Any guidance, feedback, anything before because the next time you'll see this particular budget, it'll be at full council in April.
Like I said, I think everybody's doing a great job, especially for the 2 years we faced here and what they've had to do from the TDOs to, at social services, whatever. It's been a tough couple of years, and I appreciate it all. And we'll do what we can on the budget.
I had a question going back to the first slide for the sheriff courthouse and the 2 new positions, and that you had said that sheriffs and police had met. I know the state's working on something. Is 2 positions going to be sufficient? I mean, do you feel like that's like 2 is like, it's going to maybe creep up to 3 or 4? I mean, I guess I'm trying to get a sense of, is 2 sufficient?
It's more a matter of how much overtime we want to push.
Yeah.
I believe the sheriff's request was for 2, so I honored that request and put it forward.
Okay.
I'll let him and Chief Piper speak to whether additional staff may make a difference, but 2 was the department's request.
Okay. Is 2, is that good? You guys are good with that?
Yes. 2 is fine for what
Okay.
they're going to be utilized for. It's to alleviate the TDO process and help out the PD when we can at the hospitals and stuff
Right.
like that. So yeah, 2 is going to be enough.
Okay. I just know that this is a huge issue and it's not the most efficient use of people's time, and so being able to find somewhat of a Band-Aid to that, I think, is good. So, okay. I just wanted to make sure that was.
Thank you.
I mean, like I said, there are some changes at the state level that may come through. Chief Piper's been on top of that. We went to Richmond and spoke with Delegate Wiley about it. It may be that some of those changes bring us some relief, but I think given the load currently, like the sheriff said, this will do for now.
Okay. Good. All right. Any other questions?
Mm-hmm.
All right. Well, with that, we will move on to our next item then.
Oh, I do have a question. The budget schedule, what happens from here, when, steps like that?
So right now we are in the midst of doing all the committee presentations. So we had Finance Committee earlier this month. We're here today. Next week, the PED Committee will review the Development Services budget and the Public Services budget. I think those are the two big ones. And then the next time we will see you guys is the Finance Committee on April 5th, where we'll go through a lot of the other remaining department budgets. Parks and Rec is in that mix, a lot of the smaller administrative offices, HR, IT, and some of the remaining constitutional officers. After April 5th, the next council meeting is April 12th. I was just coordinating with the superintendent today. They don't approve their budget until March 28th, so we're looking to do a work session presentation with the school system at the April 12th meeting. At the April 25th meeting is when we will have kind of another full walkthrough where we stand, before we have to get into actual approvals. Because we are not, there is no proposal to increase the property tax rate, and it is a non-assessment year, we don't have to do what we've done in past years with the not to exceed and everything. So we have a little more flexibility on the time frame, and obviously our hope is that all of these committee discussions give council and the public more time to digest this.
Thank you. Thank you. Thank you all for everything you do.
Thank you.
Thank you. All right, the next item is fire and rescue update with Chief Henschel. They're all walking. They're all walking out on you.
Meeting over?
Look at that.
Good luck, John. I'll be right back.
Are you here for moral support? You just didn't want to leave.
What did they say? Go fly a drone or fly a kite?
Fly your drone.
All right.
All right, Chief.
I just did a lot of this at the Insight Academy, so this will be a repeat.
Oh, good. Good.
Okay. What I wanted to do was give you an update on where we are with fire and rescue and talk about some of the things that we not only accomplished, but what we're pursuing as goals this year and in the future as well. So just a quick breakdown on our 2021 stats. Our emergency responses, we had 64, 81 for a total, and you can see the breakdown there from medical response to structure fires and other responses. That was a 12% overall increase for us last year in call volume. So very significant considering, I'm sorry.
Yeah, the other responses, is that things like car crashes or what is other?
So medical responses are pure medical calls on the EMS side,
Right.
The ambulance calls.
Sure.
Structure fires are the true, where we had fire and structure, we had to go and put it out. And then other responses are all of those other things we respond to. So it could be fire alarms, it could be calls for lift assist and those types of services, outside trash fires, I mean, let's go on. Smoke detector checks, different things like that along the other.
All right, thank you.
So the 12% increase in overall call volume during the midst of ongoing COVID was kind of an anomaly, but it still positions us. Our demographic is very high in call volume by comparison to a lot of jurisdictions with similar demographics. So we continue that upward trend, and that's why we're looking at addressing items as we go along, so we can make sure we're managing that call volume appropriately. Personnel training. That was a 27% increase in training to a total of over 34,000 hours for the year. Combined training, that's recruits, coupled with all of our incumbents that had to achieve different certifications as well as reoccurring ongoing training. So I was very pleased with that number and that increase. Public education and community events, 1,684 people reached. That number is actually very low by comparison to the year before. And that was a direct result of COVID and some of the events that we had to cancel. Schools, we weren't getting into schools doing the typical pub eds we could do and things like that. But we intend this year, as long as COVID stays where it's at, to get back in and really hit some of these programs hard. Fire code inspections and investigations is a total of 662. And again, that number fluctuates. That was actually an increase, but we intend to really make that robust. And that's one of the strategic plan items you'll see as well. 2021 accomplishments. Some of this you guys are certainly in tune to because of your involvement with fire and rescue, which is very much appreciated. Internal promotion of 8 officers. A lot of that resulted as a domino effect from my promotion down. But the beauty in that was that we were able to promote everyone internally, which was a significant boost for morale. When you go outside, there's a tendency at times for internal candidates to feel like, where do we lie in this community? So that was a huge morale booster. It did great things for our department. I truly don't know if with the size of our department if we'll ever see 8 again in a single year, but that was a tremendous accomplishment. Excellent service delivery to the community. There are a number of examples that could be provided where our personnel went above and beyond even the routine things they do to meet fire and EMS service needs. some of that gets shared. I send a weekly message out to staff detailing some of the things that have been accomplished, and that's sent to the city manager as well. So he gets to see some of that as well, some of those accomplishments. Mission Lifeline Gold Award. So we hit the 47% cardiac arrest resuscitation rate. That is tremendous by comparison to the national average. I attribute that to the demographic we work within. Since we're inside 9 square miles, we have quick response times. That certainly plays into it when you look at AJ and the time involved to start CPR, maintain those resuscitative efforts, and that really lends to our success. But it also attributes to the staff and their training and the utilization of devices like Lucas and some of that advanced technology that we have at our disposal. So great rate. I've shared a little bit that I worry hitting such a high threshold because there's a tendency that number could come down if we just have a bad year where we hit a roadblock with the folks we're encountering and some of their medical background. We did increase operational staffing thanks to council, 3 new positions, and likewise we had 3 additional positions added. That part of that will be another recruit academy that we intend to start probably the beginning of summer. So with a couple of openings we have, we should be starting 7 at that point. And then of course we're going to see what happens with SAFER. If we're fortunate to get SAFER, we'll be looking at another recruit class into the year beginning of 23 thereabouts. In regard to staffing, I've been asked to share a little bit about the staffing plan moving forward. So we had talked originally about 13. If we had added 13 to our overall staffing model, we could get to that point that we want to achieve adequate staffing on our suppression apparatus. And that would be 3 on each piece, which allows us to have that driver operator that could operate the pump on the engines or the aerial device on the ladder, and then a crew of 2, so we're not trying to mix and match personnel. We are rapidly moving in that direction, which is tremendous to me because I never anticipated it occurring so quickly. But the 3 we've added, the 3 we're getting ready to add, if we're successful with this grant, that will reach the 13 mark in rapid fashion. I don't know that we could have ever dreamed of happening so quickly. If we're not successful with the grant, then we will of course be seeking additional positions year to year from council until we fulfill that number. But that's the plan moving forward at this point. Administrative vehicle replacements. So we had on the docket to replace 3 of our vehicles this year, and by the grace of ARPA and the city manager working with me, we worked through some options, and quite frankly, we got lucky. So the lack of vehicles out there, coupled with the lead time, if we weren't able to procure a couple more now, and the increase in cost, prompted us to go ahead and act. So what we ended up doing is we found 2 additional vehicles that would fit the need. And I know it was mentioned earlier about thresholds that we look at. So for instance, my vehicle is 13 years old, so it's well over the time frame, but it's under the 100,000 mark. It's got 96. It would have been replaced next year, but then we'd be looking at 18 to 24 month lead times, is what we're being told. Likewise, we were told that it could be anywhere from 25 to 30% increase in cost. So it made the most sense to go ahead and tackle this now with available ARPA funds and get it done. So Dan did wonders for us in helping us achieve that goal, and thus we replaced. We're set up for long term now with our administrative vehicles. Training center modifications. So through the budget, we received some monies to add air conditioning, for instance, to our bathrooms, a couple of modifications to the classroom itself. So we got those done. Our training overall to date, 27% over the course of last year, which is a great, a good jump in the right direction. We've implemented some training requirements that you'll see that number increase even more this year. And what we're doing now is we're tying that to the requirements from ISO. What that will do for us is give us a big boost in that section of what ISO reviews, and we will be under that review later this year. So we'll be looking to enhance what our rating is in regard to ISO, and I'll touch on it a little bit more here in a minute. Community risk reduction restructuring programs. We've talked a little bit about community paramedic, and I'll get to that on the next slide. We've implemented our Remember and Win program. So the posters are out. We've got the door hangers done. So we'll be doing some canvassing periodically throughout the year, like we've done in the past with smoke alarms. We'll kind of tie the two together. We're also reaching out, as they will allow, to some of our larger venues like 27 South Cameron, the 55 and older community of Willows, Westminster, some of those, so we can get in front of them, do our presentations, and offer our assistance. Likewise, our folks will be taking note when they run calls in certain places. If someone warrants consideration, they will offer that to them when they're actually at their home. So that's one program. Our child public education effort in the schools, we are in the process of revamping that program to enhance and bolster not only the numbers we're going to reach this year, but also what that program entails. We're also expanding that to include middle school age children. So we're trying to capture a lot more through that process. Deployment enhancements. I can't recall if I touched on that the last time we met, but we changed some of our deployment model that started January 1st. This couldn't have come at a better time when think about increased costs with fuel primarily and in general with the inflation. So what we've done with deployment is twofold. One, we assessed all of our call types and looked at where we could reduce back having to send an engine or a ladder truck out on some of these EMS calls. So we kept obviously the high level calls, the more critical calls we're going to continue to run first responder because there's a need for manpower on those incidents. But some of the calls that we kind of wavered on, we opted to go with a single unit response. If they arrive, it's not as critical. They find a need and they can call and they can come in non-emergently. So just trying to reduce the amount of time the apparatus are on the streets, the manpower involved, and the money involved from a fuel and wear and tear perspective. And then the other piece of this is we are now running some of our calls non-emergently. This is another huge piece that lends to liability on the opposite side, where we run the risk of an accident out here. If we go out the door, for instance, on a general illness call, somebody's got a cough, because these are the types of things we're running more and more frequently, and we run that in an emergent fashion, and we hit a vehicle, wherein lies the liability. We're gonna eat that. So looking at the overall model, utilizing what we have in place at ECC with their priority responder, because they can ask the subset of questions to determine and triage, in essence, what that looks like. We've defined what calls we can run in a non-emergent capacity. And it's been astonishing, really, look at the numbers. I know the first month we had about 100 calls that we ran non-emergently with no issues, of course. So that's working well. Everyone's embraced it. They've actually been discussing for some time that they felt like there were some unsafe responses. So it's worked to our advantage. First due responder and pre-planning platform. So the first due responder platform is up. That ties to call information and specifics when the call comes in. It comes to everybody's individual devices. It also comes to our tablets we use on the units. The pre-planning, we're not completely up and running with that. We found a few snags initially. We wanted to work them out before we roll the entire program out. But that's that program that provides the template pre-plan for every structure in the city, and then we can build it out from there. And it also incorporates all of the technology from GIS and all of our different available technologies to upload the information we already have in place. So we're working through building that out. Once that is fully implemented, we'll move to the Community Connect piece, which ties to community members having the ability to upload any information they deem they would like to share with us in a secure location on this platform. So for instance, they have young kids. They want to say, hey, we've got 2 kids on the 2nd floor of our residence. If they want to provide an exact location, great, so be it, because that will help us if we come in for a structure fire, for example. Disabled individuals, elderly individuals, that type of thing. So we'll roll that out, we'll market it out so that the public is aware once we get to that point. We feel that will be a nice tie with this pre-planning piece that we've got. grants and budget enhancements. As we've discussed in the past, we've been aggressively seeking grant opportunities, any and everything we can come across. We've been successful thus far with a lot of our grants. Unfortunately, one of the big ones, the SAFER, we weren't last year. We're hopeful for this coming year. We did, since we last met, receive confirmation that we've gotten the grant for AEDs. So we will be receiving AEDs probably 6 months from now because there's a lead time with them as well. But we'll be updating that on all of our frontline apparatus and then rolling some of our older AEDs out back into some of the city buildings where we have some that are going to be expiring beyond their life expectancy. Budget enhancements, city manager mentioned some of the things we did with fire budget and transitioning some of the cost over to our EMS revenue budget. We did that through some MOUs with the volunteers. So you guys went through the formal process of seeing what we were dealing with the overarching MOU, the length of time and all the discussion and so forth. Beyond that, we had the intent of doing individual MOUs with each station for items that were particular to those stations. So those documents were created, and we tied in the EMS billing, what was formerly the EMS billing MOU, as a piece of this to fall in line with what the city ordinance says, and to make some changes that were applicable because of our current circumstances. So what that meant was, for example, Friendship has asked that we begin to manage their Medicaments. So in the course of that action, as a part of our, as we build some capital and some infrastructure for the city, we lowered the threshold of how much money they were receiving. So then we'll be utilizing some of that for maintenance, repairs, those types of things as we go along instead of pulling that from the fire budget. So that's one example. We also reduced the threshold for routes because at present they only have one unit in play by comparison to their counterparts in the other stations with the ambulances and the engines in play. So that's how we enhanced some of that and moved it over to that budget. Outreach, just some items of note from community outreach. We did the volunteer recruitment video. We had apprised you guys of last year. Numerous scheduled community events, from Memorial Day presentations, foundation initiatives, civic organization presentations, National Night Out, Tunnels to Towers, community safety fairs, and numerous pub ed events that we were able to still put on even in the midst of COVID. So a lot of things that we were still able to complete, even, as I look back, it was kind of interesting, even in the midst of the COVID, a lot of cancellations we received. Smoke and CO alarm program. So we've had a smoke alarm program out there. We're going to enhance that and add a CO alarm component to it, and mirror it with our smoke alarm program. So that'll be an addition. Fire extinguisher training. We've done trainings for several businesses in town. Some of our adult care facilities, we've been training for their staff members. Campus fire safety. We have an interesting dynamic over at SU with an inability to cook or microwave popcorn. So we worked with those folks on how we can reduce the number of fire alarms running over there. So kids are always fun. Home safety inspections, we've begun that process, and that ties back to the Remember to Win program. Private business training burns, so we've done Exalta and a couple other businesses in town that have their own fire brigades or fire response for their industrial facilities. They have requirements for annual training burns, and we've helped facilitate that at our training center with some of our folks in tow, just to make sure everything's done appropriately and they're operating safely. Families in need assistance, so we're looking for opportunities throughout the year this year, and last year what we did a couple of events where we assisted some families in need. The last was the Christmas event that you guys are aware of, where we pulled together with DSS, the foundation, and the local union, and procured some funding so that we could offer assistance to families and kids in need at Christmas time. So pretty good, I felt like, with what we accomplished last year, and again, the intent is to do bigger and better this coming year. Some of our programs, TMO, which is the adjunct to the SWAT call-outs, the active shooters, that's our medical component, where they go with them and they provide emergency medical service if needed, so they're on site when those events occur. Drones were mentioned earlier, so we are a part of that SUAS response team. We have a drone at South End in the center of town. and we have several pilots as a part of that group. Regional Hazmat Response Team, we continue to manage that with Frederick County and operate accordingly. Community Paramedic Program is new, and we've upstarted that. I'll get to that more in depth in the next slide. Remembering when I've already touched on. Fire and Life Safety Education Program, that's the enhancements for kids. Child Safety Seat Installation Program, we're only one of a few jurisdictions actually in the state that offer this. So we're proud of that, and we intend to enhance that and market that out a little bit more as well. Juvenile Fire Center Program, we've had it in position for a number of years, and we're bolstering that. I've already mentioned Smoke Alarm CO Program. We're enhancing our chaplaincy and CIS program. So we're going to add a pastor, a local pastor, which is a referral if any member has need or if we have a significant event. We bring those folks on board and they work directly with our CISM team as well. Airsoft technicians, you guys are aware, we've gone through many SCBA, the air packs, that we have certified technicians which help reduce cost. So we don't have to send things out, pay for them to get repaired, and wonder how long it's going to take to get back. So that's been essential. Infection Control Officer Group, which was very instrumental over the course of the last 2 years with COVID. So they've addressed a number of things from research and notating where we're at with things and how we're going to approach how we treat patients and engage them. Honor Guard Group, we're still working with that group. We intend to try to bolster that, generate some more interest. And then the Regional Canteen Unit, which of course would come out on a major incident to help with rehab. Community Paramedic Program. So I'm extremely pleased with the progress this program is making. We've got the paramedic vehicle in, we've got some equipment, and we're procuring a little bit more. Our paramedic, Rob Schmidt, was hired on February 17th, and he has been a banshee, getting information, meeting people, doing all the things that I would expect, and he's actually exceeding my expectations. I tell you, we had a joint chiefs meeting this morning with all of our officers, and one of them brought up that even though we're not at a point where we fully want to roll this program out because we're still spinning him up on a lot of the information, they had a gentleman at Watts that has been a repeat customer on a daily basis at this point. So they had reached out to Rob and Jeremy and said, hey, I don't know if there's anything we can do. I know you're just starting this. Is there a way? They went out and met with the Watts members, went to dialysis, which is one of his issues, and met with the dialysis group, and then went back and met with this individual, and he hasn't called in 2 days since they did that. So likewise, he also provided feedback to the providers that had the concern. So they were ecstatic about not only what it did, but him providing feedback. I couldn't ask for better.
Potential. So when we first talked about this like a year ago, it was a new concept. Chief jumped right in, fully embraced it, and I'm very excited about it because even today, I was out walking the walking mall with some officers because nice day out, a lot of people, some panhandlers, some homeless individuals out in the walking mall that were, we got some complaints, there's some issues, and it was those folks, it's someone like Rob coordinating with the police department and other, residents to try to address the social determinants of that, because we can't, as we talked before, Piper and his team are not going to arrest our way out of it, and we're very limited based on what federal courts will allow us to do in those situations. So somebody like Rob and this program, I think it's going to do wonders for actually addressing some of the root cause issues as opposed to just slapping a Band-Aid on it. So thank you, Chief.
So we've been in the process of his in-service. He's met with the majority of our operational staff members. He's researching the program parameters, reviewing SOPs and program platforms. We did purchase a program specific to this program through ImageTrend, which is our reporting system for emergency medical calls. And it has a wealth of information and tracking mechanisms, data metrics, all the things that we're going to utilize moving forward. Developing program participation criteria, which is a big part of this program. meeting with key stakeholders. I don't know at this point how many, but I know it's been a lot. He's been out almost daily meeting with people. You know, he's met with Becky. They've had some good conversation. We just met with Charles at Access Independence. The nice thing about Charles is he said, whatever you guys need, I'll move you to the top of the list. So I love it. But they have, of course, wheelchairs, canes, walkers, large devices for phones and different things for hearing impaired. I mean, anything we need is going to get us. So he's been gung-ho with that. And then shadowing other programs. Another beauty of the fire service is our relationship with other jurisdictions. So the longest serving program in the state is in Chesterfield since 2014. And then another rather robust program is in Chesapeake. Both of those fire chiefs have offered us for him to come down, ride with their program reps for a couple of days, glean some insight and information from them, and then bring some of that back to us that we can utilize. So another kudos to Rob in that effort. I mentioned that to he and Jeremy that we want to do that at some point sooner than later. And I said something to him today about I'd like to accomplish this by the end of April so we can really move forward. He said, already done, Chief. He said, in 2 weeks I'm going to be in Chesterfield, and mid-April I'm going to be in Chesapeake. I said, you're the man. So he has really embraced this, and he's just fast forward, which is great. So some of our goals for 2022 and then into the future. Strategic plan, you guys know that we created a 5-year strategic plan, and what we intend to do, and in fact I've got a meeting next week with command staff. We're looking at items that we deem were year one items or high priority items. And we are going to begin tackling some of those we've actually been in the process of doing things with, but we're going to be tackling those holistically over the course of this year and really drilling down. This is a document that I want to see, it's a living document, but I want to see it really come to fruition with the action items we've established. Increase operational staffing levels, we've talked about that already and what the intent is behind that. Increasing inspections and outreach programs, which is a part of the strategic plan. Recruitment and retention program. I just had a nice conversation with the Insight Academy about what we're hoping to do with the Innovation Center and through that EMT class, and Mo has been working with us on that. ISO review and state of EMS accreditation. So the ISO review will be coming forward roughly in the fall. I don't have a tentative time frame yet. We have already done a lot of things to enhance some of the ratings we should receive in each category. I can't tell you at this point if we can stretch it to achieve a 1, but if we're not able to meet that goal this year, I feel certain by next year we should be able to have a reassessment done and try to achieve that goal. So that's a big ticket item for me, and one that everybody's on board with doing with a number of things we have going. State EMS accreditation, so that is not the full-on Centers for Public Safety Excellence that does the fire service accreditation, but it's a step in the right direction. It's a smaller version that focuses on EMS at the state level, but it also has a lot of those components that I think will set us up for getting our feet wet, if you will. And I feel like we can achieve that by the end of the year. Continuing to improve teamwork, health, and safety, working with Frederick County and our regional partners. We're still having our mutual aid meetings and discussing some of the impacts we're facing across jurisdictional borders. Completing apparatus replacement and funding plans. We talked about those medic units. We have put in for an engine through AFG grant. If we're successful, we know there's going to be somewhat significant lead time, but it could tie nicely to when this station comes into play. Fire and rescue facility studies and station replacement. You guys are aware of the conversation that we've had in regard to South End and moving forward with that. We'll be setting up a meeting with their leadership shortly and an associated letter of intent. Community paramedic and risk reduction programs, again, continue to enhance and bolster those programs, and then just continuing to improve overall service to the community. Our folks do a great job, but we're always looking for ways we can improve and enhance the services we provide. And that was it. Any questions for me?
That's great.
A quick down and dirty update. But
Yeah, no, that's great.
Chief, I know it was just a short time ago we had that study and realized we only had 1 per vehicle. And it's exciting to hear we are at 2, and if we get to safer, we may be close to 3. That's ecstatic. I love it. I want to appreciate what you and all your team and city manager and all their staff have done to achieve that. That's great news. We'll need it just as well in the future as we look at the number of housing and residence units coming on board. I know you're planning for what we have now, or maybe into the future a little bit with Westminster expanding and things like that. But we're really going to need it in the future. Strategic planning.
We are well aware of all of the PUD items that are out there, some in development, some in discussion, and so on and so forth. The good thing is a lot of that comes through Jeremy, so I'm able to have discussions with him. Tremendous potential and growth on the west side. City manager and I've talked a little bit about, we're at this point now, and obviously we want to spread this out so that we don't absorb a lot of cost up front when we talk about capital infrastructure. But there will likely be a need to really assess what we may need to do over on the west side of town at some point. And we would certainly like to get ahead of that as we look at development and what's coming, as well as I mentioned the call volume and what that's looking like. Well, if that trend continues, obviously we're stretched fairly thin right now with the call volume and all of the things that we're trying to accomplish otherwise in a preventative manner. So we'll definitely be assessing that as we go along.
Yeah, attending the graduation for the recruits last night, I heard nothing but positive excitement among your team now, and that's refreshing to hear instead of negative stuff. And the leadership between the two.
And I mentioned last night, it's refreshing to see you guys attending these events as you can, but it's we're having several council members at any of our events, and that's a big turnaround really from some of what we've seen in the past and some of the things we're doing with our annual ceremony and so on and so forth. But they recognize it and they make statements about it, so it is front and center. And everybody appreciates the support, city leadership, council, all of you. One other thing I did want to just apprise you on, it just struck me as we had talked about it. We're in the midst of a CMS audit. I don't know if that has been discussed yet. So Centers for Medicare Medicaid assesses and sets the rates for our reimbursement for that EMS revenue. So that entire budget that we have at 1.15 is set by CMS and what we recoup through EMS transports from insurance. So we were selected to be under review for federal audit this year, 2022. And I don't know how they draw it, but apparently Frederick got it as well. So we both got it at the same time. So what that means is we had to procure information from these volunteer agencies on their revenues and their expenditures. And so in essence, it was a full audit. And that was something that hadn't been done in the past. And that was something that we had a meeting back in November, and I stressed to them, we need the information. We had actually apprised them of this beginning of 21, to be honest, that we need information, we need to formulate a plan and work through this process. When we got to November, and we hadn't received anything. So we took a hard stance, and I told them if we don't get anything, you're not going to receive funding moving forward from the EMS billing side of the house until we do. And we had no choice. So the premise behind this is the CMS audit doesn't tend to be a negative impact, because in most cases they're assessing inflation and all those things and saying, okay, we know what your expenditures are likely going to be, so we want to see where you're at, and then we're probably going to increase your rate, which is a benefit because we're going to get more money. I can't recall of any time that I've researched that I've seen them decrease somebody's funding. Okay, so it tends to be a positive. The one negative impact is if we don't comply with submitting the data that they're asking for, we're subject to an immediate 10% penalty. It's $150,000. So that's why we took a firm stance back in November. We hadn't received the information that we've been requesting at that point for 6 months. And at this point, we've had 3 of the 4 agencies comply. We have a 4th that is giving us a bit of a problem over compliance and not wanting to share their information. So at this point, I'm still withholding their funding, and until they comply, then that's where we stand. I'm going to stand firm.
Does that mean that if we don't get that 4th one, that is the 10% penalty will still apply?
We're exploring that right now. We're exploring that right now.
Because that becomes then an expense to the city and taxpayers. That's correct, right? Yeah.
Yeah, so we're taking, so we don't have to, we have the full year.
Yeah.
You know, as we're gathering the data, they want to see the full year amount. So we're working through that, but it's unfortunate that they don't want to bring it to the table. So we'll keep working through it and make it detailed.
Yeah. Oh, other questions?
Yeah.
I had a couple questions. First of all, thank you for your leadership and for your team's leadership. And I mean, I just know when I first got on council, like it's night and day where fire rescue is from when I first got on council. So, and I know there's been a lot of bumps in the road on the way, but I feel like
We've all got bruises.
yeah, I feel like we've arrived, and it's a great thing because you know, it's a service that, you know, is important to our community. So it needs to be, you know, just like fire and, you know, all the other services, you know, we always need to be striving for excellence in that. So thank you for your leadership on that. So is there any overtime? Are we still running overtime with the staff? And
So
how is that?
we still have a little bit of overtime. It's not nearly at the level it was, and we had to come back and ask for supplementals once or twice. I'm sure. Now, the last time that was involved, we got hit hard with COVID, so that played into it more than what the overtime issue for staffing in general was. We probably had 2/3 of our department plagued with COVID, and unfortunately, this last round we had about, let's say it's a fourth probably out in almost one time.
Wow.
So that's where we got hit the last round with the overtime. And that has tremendously dwindled down to the point where I feel fairly comfortable moving forward. We just pushed these recruits out yesterday through graduation. Now, of course, they've got to do their field time. But once they are cleared and released in the field, we should be in pretty good shape. I do not intend to raise the threshold. So we're at a minimum staffing of 15. I don't intend to raise that threshold until I feel that we are secure and not spending that overtime for staffing. So,
Just go on what she's saying. Between the extra staffing in fire and rescue and police, you know, police is also almost at full staffing right now, which we have not been at in quite a while. So, you know, retention, recruiting, fire and rescue, what we're doing is working. And we're at a point where we're now managing overtime as opposed to just taking, you know, taking punches to the gut, in essence. There will always be some holidays, training. Yeah, there's always it's healthy too. You don't want to overhire and then have folks sitting around. So we're now at a point with, you know, police, fire, and some of our departments where we're now just managing it, and we're going to start benchmarking ourselves against other jurisdictions to make sure that we've got the appropriate level. We couldn't do that before because we had these extra factors, and we were just basically trying to triage. So, you know, I'm very happy with where we're at with staffing, fire, police chief among them.
That's good. Yeah, that's good to hear. And I know eventually it's, you know, especially with the safer, as you said, if we can get that, then that'll really kind of take care of that. It's really good to hear that so much of what you're doing, you're using data to kind of determine where shifts and changes and the whole community paramedicine program. And, you know, I mean, it just seems like that you're really using data to better understand how to provide a more effective, efficient service. And one of the questions I had with regards to that, you had talked about the call volumes. I'm sure that you guys are probably working with Valley Health. Is there something more we can understand about the call volumes? I mean, I know the falls is definitely a big deal, but is there anything else that you all have been able to kind of put your finger on as to something else that could be done, sort of like a community paramedicine program or something that could be more effective, you know, to keep people from actually having to call the, you know, fire and rescue? I mean, if they need to call, they need to call. But you know, what percent of the calls that you all get do you think? I mean, you're clearly not going, you know, full emergency for some of the calls. But I guess I'm just trying to think if there's ways that, and you're probably already doing that, trying to figure out how you can kind of keep driving those numbers.
So a lot of the issue we're facing now is the issue that is plaguing the entire healthcare system. So people can't get into doctors for a number of reasons. Some of them don't want to deal with COVID. Some of them don't want to deal with some of the stuff, some of the family practice particulars in general. So they're calling in at times to doctors' offices. They're saying, "Oh, you need to go to the hospital." Well, if they don't have a way, or they feel their illness generates the need for calling us, they're doing so. So that's a part of it right now. There are a number of things that are plaguing us in terms of that advanced call volume. Fall, as you mentioned, we run lift assists on a daily basis, and that data is seen broadly. So getting ahead of that, using the community paramedic for that, working with that program, the Room Win program, to get ahead of people that are going to be plagued by this downstream is going to be key to reducing that threshold. There are other factors that come into play here are responses to the county. So we respond out there far more than they respond in. So we've had some conversations about what that looks like and what we may need to do in the future to offset some of that. That's some conversation we're having with Frederick County. In fact, the last mutual aid meeting we had, I said, "What are your plans? Staffing, stations, what do you guys look like? What do you intend to do?" Because Frederick County is exploding worse than we are. And if they're not trying to get ahead of that curve, where's the domino effect going to hit? It's going to hit us. And we know that. And if we're already running out there more than they run in, we know that that's going to get worse if they're not planning effectively. So we're looking at that in part. We're looking at what options are going to be there at our disposal that we can have those conversations and work through some of that to understand they can't put that kind of a strain on us. So that's just, these are parts and pieces of this entire puzzle that we certainly are aware of, we're addressing, and we're going to take action as needed. That's no different than I mentioned the CMS. If we have to take more stringent action, we will. If we have to take a firmer stance, we will. But our priority obviously lies in the city.
Yeah, good, thank you. Any other questions?
Good.
No. Thank you, Chief.
Yes.
Thank you very much.
Let's see, that's the last item, so I'll entertain a motion to adjourn.
So moved.
I
All in
guess
favor?
second.
All
Aye.
right, thanks, everyone.
All right. Y'all have a nice end of your week.